Bismillahirrahmanirrahim. The question today is DHI method is method of hair transplant or technique of hair transplant. You want to have some explanation on that. We are actually divided into two categories. V means hair restoration surgeons. Number one category is who they are certified by American Board of Hair Restoration Surgery, and along with that members of International Society of Hair Restoration Surgery. These doctors are separated from other category of hair restoration surgeons. You can put them in other category. I want to explain you the background of everything. Why I'm separating these two things? Because what I think is, if you see the controlled or accountable doctors, you need to put them in some different categories. One class is uncontrolled or is not accountable to any authority or organizational body. They cannot be challenged by anyone. Like, I give you an example. If I am a member of ISHRS, International Society of Hair Restoration Surgery, and I'm diplomat of American Board of Hair Restoration Surgery, I'm certified by American Board of Hair Restoration Surgery, I am bound to follow their guidelines. Otherwise, my membership or my certification or qualification or degree will be challenged. If I'm doing wrong things, I'm saying that surgery is painless, which is not true, which is wrong. You are talking about surgery and saying painless. Is that true? Make it simple. Is that true? It is not true. You are saying that FUE is scarless surgery. Is that true? You are talking about surgery, excision of the graft with punch or with something else. Will there be no scar? That is not true. Scar will be there. And if I'm doing LSC or FUT procedure and taking out a strip, harvesting a strip from donor area, and I'm saying it will be scarless, is that true? No, it is not true. Scar will be there. So these are not true things. So we need to follow those guidelines. We need to follow the guidelines given by the organization to whom we are related to become a good hair transplant surgeon. And other thing is, if I am saying that I am the best surgeon of the world, I'm the best surgeon of Islamabad, I'm best surgeon of Asia, I'm best surgeon of Pakistan, is that true? My statement, can you label my statement true? Who made me the best one? Who made me this? Who has declared me the best surgeon? This is wrong statement. I can be expert, I can be having a good knowledge, I can be having a very good hair restoration technique, I can be having a very good grip on my surgery. But how can I declare myself as the best surgeon of the world? This is not true. This is wrong statement. So we need to keep in mind that there is somebody, I'm regulated by somebody. Every time it remains in my mind that somebody is watching me. And superiorly saying that what I say to myself is somebody is watching me means Allah Almighty is watching me. I don't care about the organizations and this thing. I'm different person. Personally, I'm different person. I say to my staff, and I have more than 30-40 girls here in my office, and I usually say to them that we are accountable to a big authority, Allah Almighty. Because once we decide with some person, I'm taking a penny from him or her, I should justify that penny. This is more important. If I'm professional, if I'm truthful, if I'm honest, this is obligation on me. I need to fulfill and I need to justify that penny I'm taking from anybody. Two things are involved in this. Number one, your qualification, your grip, your technique, your expertise. This is one thing. You should be expert in what you are doing. Another thing is you should be honest on what you are doing. These are two things. And you need to do that. If you are honest and you are not expert, it does not match with each other. If you are expert and you are not honest, it will not also match with each other. You should be having both the qualities. And accountability number one is from Almighty. If you keep in mind, it is difficult to endorse this thing on your mind, but that would benefit you for whole life, for other life as well. But in this world, we are regulated by somebody, we are disciplined one, we need to follow that guidelines, and we should implement on us. We should be taking a long history, we should be taking every care of the patient. What is he taking, like medicines, like his personality, his social life, is he smoker or not, is he alcoholic or not, illicit drugs. We need to find each and everything related to the patient who is coming to you for surgery. Protocol is mine, protocol is not his, or patient is not given some other protocols because you are doing some serious job. We should not be taking this job as a very small thing. It is not small thing. Hair transplant is big thing. It is related with the personality of the patient. You are doing something, you want to get good results, and for that purpose you need to be confined to those things. So if we are discussing DHI, it is wrong term. I want to say wrong term. FUE and FUT is the terminology. DHI is like, then I would say so many things are happening in the hair world. You can say in the whole world, DHI, sapphire FUE, chilled FUE, ice FUE, lying FUE, sitting FUE. So many things are involved in this. Now Chinese FUE, Russian FUE, Turkish FUE, and Uzbek FUE. I have heard so many things. And somebody was saying to me that there is a Norwegian FUE. Oh, what is this? So all these terminologies are wrong. There are only two techniques of doing hair transplant surgery. One is linear step surgery, which is called FUE or LSE. Another thing is follicular unit excision, FUE. So these procedures, a doctor who is meant to be an expert to me, this is my own opinion, that is who is knowing both the procedure FUT and FUE, because he will be the expert to have a best usage of your permanent donor area. He will preferably do FUT when it is required, he will be using FUE when it is required, or he will be doing combo technique when it is required. So he will not be like doing everything on his own choices or patient choices. It should be like choice is the scenario available, and every patient coming in your office is a different patient, with different scenarios, with different donor area, with different recipient area, with different quality of the donor area, with different quality of the recipient skin as well. So we need to be like a versatile expert in hair transplant surgery, and that can be achieved by getting very vast knowledge of the procedures you are doing, because you are doing hair transplant surgery, you are doing hair restoration, you should be having a big knowledge in hair restoration field. It is not, we are not doing orthopedic surgery, we are doing hair transplant. So we should be having knowledge in hair transplant and hair restoration. This is very important. Thank you very much.